Natural home remedies for pilonidal cysts. A pilonidal cyst is a chronic dermatological infection that forms at the top of the buttocks. The cyst may develop due to reaction or irritation to ingrown hair. Experts believe that any form of trauma to the buttock region may also result in the development of these cysts. Sometimes, these cysts may get infected and cause pus to collect. Who is susceptible to this infection? Find out in the following section. A family history of pilonidal cysts can be a contributing factor to determine if one is likely to develop this condition. Pilonidal cysts are observed mostly among men with a deep natal cleft. If you are among those who sit around for long periods, you could be susceptible to these cysts, as some amount of friction can cause a reaction to ingrown hairs. You are also more likely to develop such cysts if you have thick body hair. The main cause of pilonidal cysts is the presence of ingrown hair. This happens as a result of hair becoming embedded in the skin. If the cyst gets infected, it can form a painful abscess. Individuals between the ages of 20 and 30 are susceptible to pilonidal cysts. Factors that may contribute to the development of pilonidal cysts. Gender: if you are male, you are more likely to have pilonidal cysts. Sedentary lifestyle: lack of physical activity or exercise, excess body hair, poor hygiene, excessive sweating. The common symptoms of pilonidal cyst development include inflamed skin, collection of pus, and slash or slight bleeding at the site of infection. One may also experience pain and discomfort while sitting or standing. However, if the infection is acute, one may also have a fever or nausea. You may be tempted to pop these cysts to relieve the discomfort. However, doing so increases the risk of infection and scarring. Hence, it is best to consult a doctor. Here are some natural home remedies you can try out to reduce the pain and discomfort. Natural remedies to treat pilonidal cysts. 1. Warm compress. Using a hot compress a few times a day can help soothe the inflammation. The heat from the washcloth enables the cyst to drain the pus, thus relieving pain. You will need 1 sterile washcloth, a bucket of warm water. What you have to do: start by soaking a sterile washcloth in hot water. Place the warm cloth on the affected area for a few minutes. How often you should do this? Repeat as needed until the pain subsides. 2. Garlic. Garlic has antibiotic and antimicrobial properties, hence, it may prove to be effective in reducing the symptoms of pilonidal cysts. You will need a few cloves of garlic. What you have to do: there are 2 ways to employ this method. Crush a garlic clove with the back of a knife and apply the paste onto the affected area. Cover the area with sterile gauze for a few minutes before rinsing it off. Alternatively, you can ingest crushed garlic cloves with a glass of water. How often you should do this? Applying garlic once a day for a few days. Ingesting garlic 2 to 3 times a day. 3. Tea tree oil. Tea tree oil possesses antimicrobial and anti-inflammatory properties. These properties may help reduce inflammation and prevent further infection, thus promoting faster healing of the cyst. You will need a few drops of tea tree oil. Warm water. What you have to do: use water to dilute tea tree oil. Dilute the oil in the ratio of 1:10. Apply the mixture to the affected area and leave it on for about 15 minutes. Rinse thoroughly with lukewarm water. Dry the area completely. How often you should do this? Repeat 2 to 3 times daily. 4. Castor oil. Castor oil contains ricinoleic acid, which possesses anti-inflammatory properties. This may help alleviate inflammation around the pilonidal cyst. You will need a few drops of castor oil. Cotton ball. What you have to do: soak a sterile cotton ball in warm castor oil. Apply generously on the affected area. Leave the cotton ball on for 20 to 30 minutes or overnight. How often you should do this? Repeat 2 to 3 times daily. 5. Coconut oil. Coconut oil is both anti-inflammatory and analgesic. It can thus help reduce pain and inflammation in the affected area. You will need 1/2 teaspoon of organic coconut oil. What you have to do: apply organic coconut oil to the affected area. Leave it on for a couple of hours. How often you should do this? Repeat 2 times daily. 6. Epsom salt. The magnesium in Epsom salt can help reduce inflammation. Epsom salt may not only reduce pain but also promote the expulsion of pus from the cyst. You will need 1 cup of Epsom salt. What you have to do: add a cup of Epsom salt to a freshly drawn warm bath. Soak your body in it for 15 to 20 minutes. How often you should do this? Repeat as necessary. 7. Apple cider vinegar. Apple cider vinegar has antimicrobial properties, hence, it may help prevent the pilonidal cyst from getting infected, thereby assisting in its healing. You will need apple cider vinegar cotton ball. What you have to do: dilute apple cider vinegar with water. Soak a cotton ball in the diluted vinegar. Place the cotton ball on the affected area and press gently. Secure it with a band-aid and keep it on for a few hours. Remove the band-aid and rinse the affected area thoroughly with water. How often you should do this? Repeat 2 times daily. 8. Turmeric. Turmeric contains curcumin that helps reduce inflammation and relieves pain in the affected area. You will need 1 tablespoon turmeric powder. What you have to do: 1. Add water to turmeric powder to make a paste. 2. Apply this paste to the affected area. Leave it on until it dries. 3. Rinse the affected area thoroughly. 4. Alternatively, you may also grind a turmeric root and gently press it on the pilonidal cyst. How often you should do this? Repeat 2 times daily. 9. Black tea bag. The anti-inflammatory properties of black tea may help in treating the swelling and inflammation in the affected area. You will need 1 black tea bag. What you have to do: soak a tea bag in warm water for 5 to 6 minutes. Wait for the tea bag to cool a bit. Place the tea bag on the affected area. Hold it in place for 8 to 10 minutes and then remove. How often you should do this? Repeat this procedure 3 to 4 times daily. 10. Aloe vera. Scientific research shows that aloe vera exhibits anti-inflammatory and antimicrobial properties. Both these properties can help in reducing the pain and irritation that are a direct result of pilonidal cysts. You will need aloe vera gel. What you have to do: apply aloe vera gel to the affected area. Leave it on for 20 to 30 minutes. Rinse off with plain water. How often you should do this? Repeat 3 to 4 times in a day.